Mike has written, has authored or co-authored several books on the subject of mercury amalgam and the health effects associated with mercury. And the simplest way I think I can introduce him is that he is simply the most knowledgeable person, at least in this hemisphere, on mercury amalgam and its health effects. And it's always a pleasure to hear this man speak. Michael Ziff.
Thank you all. Thank you. Dr. Glass, I hate to do this to you, but I have to question you on another one of your slides. I happen to be a Floridian, and you put up a slide there. It was the very first one that had a bunch of white stuff on the ground that was totally alien to me. What did you call that stuff? That was that first slide?
Frozen rain.
Frozen rain, okay.
No.
I just didn't understand it at all. It was totally alien. I'd like to preamble my presentation today in support of the IAOMT's goals and aims, which are scientific investigation and education. And I want to do this by telling you about a few of our activities that have been going on around the world on behalf of the IAOMT. Last fall, 5 IAOMT members went to Dusseldorf, Germany. Myself and Dr. David Kennedy from the United States, 3 of our IAOMT members from Sweden, those being Dr. Mats Hansen, Dr. Jarro Pleva, and Dr. Fred Berglund, in presenting a conference on dental amalgam in Dusseldorf, Germany. As a result of that, the scientific documentation that was presented to the Bundesgesundheitsamt, which is the German counterpart to our Food and Drug Administration. The BGA banned one form of dental amalgam, and now they've been given the information on the high copper non-gamma 2 amalgams that shows that they release more, as much, if not more, mercury plus the copper. The German government has acknowledged now the IAOMT to be the scientific authority on dental amalgam in Germany. In Sweden, our Dr. Murray Vimy went over there 3 weeks ago and made presentations to the Heavy Metals Center at Uppsala University. And then he and IAOMT members, Magnus Nylander, Jarro Pleva, as well as Arne Lindvall and Dr. Lynn, made presentations to the Parliamentary Health Committee and also to the National Research Council State-of-the-Art Committee. And the German government has now acknowledged that the scientific authority the Swedish government has now acknowledged, as Germany has, that the scientific authority on dental amalgam in Sweden is the IAOMT. We had a formation of IAOMT chapters in Sweden and in Germany, and then Dr. Vimy then made a presentation the following week in the United Kingdom, an all-day presentation on the dental amalgam issue. So far, they haven't yet, in the United Kingdom, acknowledged IAOMT as a scientific authority, but that's going to be forthcoming, we hope. Then last week, 4 IAOMT members, Dr. Murray Vimy, Dr. David Kennedy, and myself, as well as Dr. John Yamianis, made presentations at the Eco-Odonto Conference. And there is now an IAOMT chapter formed in South America. The scientific presentation, the information presented on both amalgam and fluoride by IAOMT members was absolutely a bombshell in Brazil. It was on national television and several stations and on national newspapers. So this is to clarify then that the goals and aims of the IAOMT, notwithstanding the impact of dental mercury on patients, we understand this, and on the environment, we understand this. Our major goals and aims of the Academy are scientific inquiry and education. Have I covered pretty much, Dave, on
As much as I can remember.
It's been a hectic several months, I'll tell you. So that aside now, let's enter into our formal presentation for today.
Put the mic on, or you want to stand?
He told me that it was all right having the mic here. Is it coming through okay?
Yeah, that's fine.
Let's first of all take a few moments to review the scientific information on dental amalgam. In order for a dental filling material, any dental filling material, to present a systemic risk to patients, 4 criteria need to be satisfied. 1, the material must contain a toxic element. 2, that toxic element must exit the restoration. 3, it must be able to enter the body. And 4, it must reach harmful levels within the body. All 4 of these have been scientifically proven, documented in the case of dental amalgam, and specifically mercury from dental amalgam. Most of you have heard this time and time again. I need not belabor the point. I will simply cover a few of the highlights. In 1984, the National Institute of Dental Research and the American Dental Association publicly acknowledged that patients are exposed to mercury from dental amalgam during chewing. This was published in the Journal of American Dental Association, volume 109, in September of 1984, pages 469 to 471. So at that point, the dental profession could no longer claim with any validity whatsoever that mercury was locked in the dental amalgam, period. In that very same issue, the NIDR and the ADA publicly acknowledge that measurements of mercury in the blood, urine, and hair do not correlate to body burden or toxic effects of mercury. This is in the transcripts of the workshop on the biocompatibility of metals used in dentistry. It's also in the Journal of American Dental Association, volume 109, September 1984, and it's also in the ADA News, July of 1984. This is very disheartening and disconcerting in view of the fact that subsequently to 1984, the American Dental Association and other elements in the dental profession have made claims that mercury exposure from dental amalgam is not harmful to patients based on measurements of mercury in the blood, urine, and hair. Since this is published in the Journal of American Dental Association itself, and documents such as the Langan, Fan, and Hoos article of December of 1989 in JADA conclude that dental amalgam, the mercury exposure from dental amalgam is harmless based on measurements of mercury in blood, urine, and hair. And 3 pages prior to that, they state that it's not valid. This is rather an embarrassment to the dental profession. The World Health Organization, as Dr. Glass showed you, has several documents on mercury. The most recent of which is the 1991 document, Environmental Health Criteria 118, inorganic mercury. That was one of the 3 that he showed on the slide. The results of the special committee established by the World Health Organization of mercury toxicology experts from around the world in determining and evaluating all the published scientific data were that the average daily dose of mercury from dental amalgam was on an average 4 times that as the average non-occupationally exposed person derived from the diet. The figures that were in the US EPA document were from 1973 and republished in 1984 and did not include dental amalgam. In 1988, Clarkson, Freeberg, etc., came up with the first calculations. These are the world's foremost toxicologists on mercury, and they came out about this in the World Health Organization committee, which did not include Clarkson and Freeberg, but did have Berlin and Skirting and a number of other, Nordberg, a number of other mercury toxicology experts came up with the same figures that the daily dose of mercury in the general population from dental amalgam is much higher than that from food. So that is pretty much been determined, although in last month, this month or last month, in the Journal of Dental Research, another 9-page article came out by Drs. Bo Bergman and Olson in Sweden, once again questioning the daily dosage from mercury based on calculations found in the published literature. This is all moot now. This sort of an approach to how much mercury are we getting from dental amalgams is all moot, the vapor analyzation procedures. Because last month, April 1992, a study was published in the FACET Journal, Federation of American Societies in Experimental Biology, by Apashian and Associates at the University of Arizona in Tucson, conducting a study utilizing DMPS as a chelating agent. Dr. Apashian is probably the world's foremost expert with many publications on this, and determining the amount of mercury removed from the body into the urine after chelating with DMPS. And his results found that roughly 2/3 of all the mercury in the body comes from dental amalgam. Interestingly enough, approximately the same time, published in January of 1992, another research team in Germany, led by Zander, published their results of a similar study, almost identical study, independent of each other, and found the same thing, that when human beings are given chelating agent, DMPS, that the vast bulk of the mercury coming out of the body is amalgam derived. It correlates to the amalgam, the amount of amalgam in the teeth. So right now we have hard scientific data. No more guesswork, no more opinions. It's hard scientific data demonstrating that the bulk of the mercury within the human body is primarily derived from dental amalgam fillings. So this numbers games are pretty much over, even though the dental profession obviously disagrees with the world toxicology experts on that. All right, now what about the harmful levels? Well, let's look first at the same World Health Organization document. That's Environmental Health Criteria 118, Inorganic Mercury, 1991. World Health Organization, on page 111 of that document for mercury vapor, the World Health Organization states, quote, a specific no observed effect level, that is an OL, cannot be established for mercury vapor. In other words, the World Health Organization toxicology experts say there is no toxic threshold for exposure to mercury vapor. They also stated in that document that measurements of mercury in the blood and urine are not valid body indicators or toxic effect indicators. So this seems to be a well-accepted concept outside of the dental profession. In the toxicology circles, the measurements of mercury in the blood, urine, and hair do not correlate to body burden or toxic effects, and therefore cannot be used to determine the safety or lack of safety of a mercury material. And if that isn't good enough, we can go back to 1984 to that same U.S. EPA document that Dr. Glass showed. On Chapter 2, page 7, for mercury vapor, it states, quote, no threshold for these and other effects has been clearly established, unquote. In Chapter 6, page 12 of that document, it states, quote, the dose-response relationship depicted in Figure 6-5 does not exhibit any clear threshold. That's for mercury vapor. It also states in that chapter, page 21, that measurements of mercury in blood and urine do not correlate to the toxic effects of the mercury. So there's absolutely a complete agreement amongst the mercury toxicology experts that no amount of exposure to mercury vapor can be considered totally harmless. This is contrary to the position taken by the dental profession. So now it boils down to who is a greater authority on mercury toxicology, mercury toxicologists or dentists. And I think this is the way it's going to turn into the future. So much for that. In summary, it has been scientifically established and documented that as regards dental amalgam, it contains a highly toxic mercury, scientifically proven to be more toxic than cadmium, lead, or even arsenic, and with no toxic threshold for its harmful effects. Number two, it's scientifically established without a doubt, there's just no debate on this whatsoever, that mercury is not locked into the dental amalgam. There's no question. So it has also been established by virtue of the Apashian and Zander tests, and by virtue of the 3 published human autopsy tests begun in 1984 through 1987 in Germany, Karolinska Institute, and here in the United States, that patients are chronically exposed to mercury and that the mercury does build up in the body with time. This is dental amalgam mercury. And of course, The scientific experts, the toxicology experts say that there's no toxic threshold, therefore no amount of exposure can be considered harmless. Now, the only thing left at this point in time is the research demonstrating adverse effects, and this is what I'd like to demonstrate the first part of my presentation today, directed towards. I'm going to discuss some of these aspects today. The scientific documentation demonstrating that mercury from dental amalgam does cause adverse effects. I will discuss the renal effects, the gastrointestinal effects, and I will also discuss some areas where mercury has been connected to pathological conditions, and the investigation of dental amalgam mercury specifically has begun. I will not discuss the periodontal and lichen planus and allergic effects. That's a 30-minute presentation that I gave to the National Institutes of Health, and that they said that they did not acknowledge that they did not consider in drawing their conclusions about the safety of dental amalgam. I have that in writing, and it's on record, but they didn't include it when they drew their conclusions. So I'm not going to discuss those issues. I will start with these others, but before I do that, we have to begin logically on this. Once it's been determined, these other factors have been determined, the first thing that needs to be done is we need to find out exactly what happens to mercury from dental amalgam once it exits the restoration, the filling material, how it enters the body, where it goes in the body. And so we're going to first discuss some of these tracer studies that were conducted at the University of Calgary School of Medicine by a group of researchers there at the University of Calgary School of Medicine that were MD and PhD research scientists with one dentist involved, Dr. Murray Vimy. Their studies began to be published in the Journal of Dental Research in 1984, where they first of all measured the amount of mercury coming off dental amalgam fillings under different conditions, so they could determine what kind of a level there was and compare it to the animal studies to see if we're in the same ballpark. Once that was determined and published in the Journal of Dental Research in 1984, the next step then was to trace the mercury into the tissues. Now, how do you do this? Well, the best way of doing it is to somehow label the mercury that's in the amalgam so you can follow it from the filling to wherever it goes. And the way this group did this is they used radioactively labeled mercury. Now, first of all, medical science works this way. You don't take a highly toxic material that is more toxic even than arsenic and experiment on human beings with it. You first of all experiment on animals and see what it does. If it seems to be okay in the animals, then we'll consider using it in the human beings. That's the way it's done. Well, it hasn't been done with dental amalgam, so now the animal studies were initiated. And they started off with just one sheep. And they selected the sheep as the model for several reasons. Number one, the sheep is approximately the size and the weight of an adult human being. Number two, the sheep chews with their molar teeth, unlike mice and rats and dogs and guinea pigs and animals of this nature. So you want an animal that functions pretty much like humans. Number three, the sheep happens to be the obstetrical model for human beings, and the University of Calgary Research Center is one of the top obstetrical research centers in the world, and the sheep were there and were available, and it was part of their protocol. Number four, the sheep is an exaggerated model. Not only does it chew with its molar teeth, but it chews a lot more than a human being does. Therefore, if you find something in the exaggerated model, then you look further. If you don't find it in the exaggerated model, then there's no point in looking any further than that. So these are the reasons a sheep was selected. Their first study was published in December of 1989 in the FASEB journal. FASEB is Federation of American Societies in Experimental Biology. It is an umbrella organization for the physiologists, toxicologists, biochemists, pathologists, etc. The FASEB organization encompasses nearly 34,000 medical research scientists. There are no less than 7 Nobel laureate medical scientists on the FASF Journal Review Board, and most of the others will win a Nobel Prize in their career, during the course of their career. The FASF Journal publishes only 24 studies a year. That's all, of all the thousands they get. 12 review, 12 basic research studies. This group got 2 in FASF Journal in 1 year. This is the epitome of peer review in medical science, period, bar none. When a dentist says this is flawed research, and the Nobel laureate medical sciences have accepted it, it opens some questions about the capabilities of whoever is criticizing this. So, here we have this first study. This is a tracer study for one reason only. They wanted to see where the mercury went. So they label 1 out of every 10 molecules with radioactivity. Why do you need only 1 sheet and not have controls? Well, radioactively labeled mercury does not occur in nature, period. If any radioactive mercury, labeled mercury, was found in the body of these animals, it could come from only one place, the fillings. It could not come from the food. It could not come from the air, and it could not come from the water. It could only come from the fillings. So on a tracer study, that's all you need. They placed in this one sheet 12 occlusal amalgam fillings. Each one of these fillings was 1/2 the size of an average amalgam filling in a human adult. And they overcarved them concave to make certain that the rumination would not result in excessive amounts of mercury exposure to the animal, and they packed the throat to make sure that none of the scrap amalgam would go down. They took intraoral mercury vapor measurements and found that the amount of mercury coming off these amalgam fillings on this sheet was about the same as they had found in their previous human studies. Okay, so we're in the ballpark so far. Then, after 29 days, they sacrificed the animal, cut the teeth off to the gum line so that all the amalgam fillings were out of the mouth, and they did a whole body scan, and this is what they saw. The sheep was laid on a table with the scanner camera going underneath it. The sheep was laid on a cesium blanket so that there was an outline of the animal. You see all those dots around the outline of the animal, that's the cesium. Cesium is a very low penetrating radioactivity, so that the camera would then show, it will not penetrate the tissues of the animal, but it will show outside of the animal so you have an outline. Each one of those black dots then represents 1/10 of the mercury in that location within the animal. Obviously, we can see some factors here. There are areas where there is an accumulation of the mercury. The gastrointestinal tract, which is the A, the C, which is the mouth, after the amalgam have been removed, and then the kidneys are B and the liver is D. Now, in their scintillation counting then, they determined that the uptake sites of the mercury from the dental amalgam fillings were the lung, the jaw tissue, and the gastrointestinal tract. And the amounts of mercury they found in nanograms per gram of tissue, the highest levels were in the kidney, stomach, and liver, but there were substantial levels of amalgam-derived mercury in the gingiva, the alveolar bone, and the trachea. Other areas where they found, after only 29 days, this is only 1 month of having the fillings in place, the other areas were the spleen, pancreas, pituitary gland, thyroid, adrenal, lung, ovary, brain tissue, and heart muscle. And the levels of the mercury that they found in the whole blood and in the urine were a great deal lower than levels found in most tissues, meaning then, once again, that the mercury from the fillings passed into the body, into the blood, and out in the tissues very rapidly, and that measurements of mercury in the blood and urine were not indicative of the amounts of mercury found in tissues, and this substantiated all the previous evidence that measurements of mercury in blood and urine are not valid indicators. Their conclusions in this first study were that the study clearly demonstrated that substantial quantities of mercury from amalgam will appear in various body tissues as early as 29 days after placement of the amalgam fillings in teeth. They also stated that their laboratory findings in this investigation are at variance with the anecdotal opinion of the dental profession, which claims that amalgam fillings are safe. They also stated that from our results, they concluded that the dental amalgams can be a major source of chronic mercury exposure. Okay, this is what we find in the sheep on a tracer study on one animal. Now, next what we want to do is see if the mercury placed in pregnant females will pass into the fetal tissues of the unborn babies. So in this study, this was published in the American Journal of Physiology in April of 1990. Once again, one of the top peer-reviewed medical scientific journals in the entire world. They investigated 5 pregnant sheep. Once again, this is the obstetrical model for human beings. They placed, again, 12 occlusal amalgams in the molar teeth of these sheep. Each filling was 1/2 the size of an average filling in the human being, and it was overcarved to be concave to avoid excessive wear. Once again, they took intraoral mercury vapor measurements and found them comparable to those they had found in human beings. They also took samples of blood, amniotic fluid, and feces and urine for the first 1 to 3 days. Then, the tissues were sampled at various days of the course of the experiment. They did the measurement of radioactive isotope in specific tissues, that's the scintillation counting, and also in the blood and tissues of mothers and fetuses, placenta, amniotic fluid, mother's milk, and urine. And here's what they found. After 2 days, the mercury from the amalgams, this is radioactively labeled mercury, can come from no other place other than amalgams. They found the mercury in the maternal and the fetal blood and the amniotic fluid, in the maternal urine and in the feces. The mercury levels that they found in the fetal blood averaged 4 times higher than the levels they found in the mother's blood. After 16 days, the highest levels of amalgam-derived mercury they found in the mothers were in the kidney, liver, GI tract, and thyroid. In the fetuses, the highest levels they found were in the pituitary gland, then followed by the liver, the kidney, and the placenta. At 29 days, which was the birth time of these animals, most of the fetal tissues had higher levels of mercury than did the maternal tissues. The fetal levels were higher in the liver, brain, bone marrow, blood, bile, and long bone ends. During lactation, the levels of mercury, amalgam-derived mercury, once again radioactively labeled, that they found in the mother's milk were 8 times an average the levels they found in the mother's blood. So in any animals that were nursing babies, they were getting in more mercury from their mother's fillings. At the end of 73 days, the maternal mercury levels in tissues continue to rise in the kidneys, liver, parotid glands, lungs, GI tract, adrenals, pancreas, pituitary, urine, bile, brain, and thyroid. Now, before you ask the question, I'll answer it. They didn't go much beyond this because the half-life of radioactively labeled mercury is very short. You cannot conduct an experiment with radioactively labeled mercury and run it off for a long period of time because it no longer is radioactive. You cannot measure it any longer. All right. They concluded after this experiment was conducted, published in the American Journal of Physiology in 1990, that mercury released from dental amalgam tooth fillings will begin to selectively accumulate in maternal and fetal tissues soon after amalgam placement, that the milk concentration of amalgam mercury postpartum provides a potential source of mercury exposure to the newborn, and that in view of the experimental evidence presented herein, continued employment of dental amalgam as a tooth restorative material in pregnant women and children should be reconsidered. Already advised against in Sweden and Germany now. Okay, now so far what these researchers have now found out is yes, the mercury comes off the amalgam fillings very rapidly. Yes, it does enter the body. Yes, it does accumulate in certain tissues, and yes, it does get into the unborn children. This is in a sheep, which is perhaps not a human being, but perhaps closer to a human being than a guinea pig or a rat or a mouse. So, now that this exaggerated model was shown to have these results, the next step then is you select an animal that is even closer to humans, and in their case, they selected the monkey. So their next step then is they repeated the initial experiment, this time with a monkey. This was published again in the FASEB journal, the top medical science journal in the world, highly peer-reviewed on it. They took one monkey, which of course is a primate and is extremely similar to humans in function, but not so much in body weight this time. They placed 16 occlusal amalgams averaging 93 milligrams of mercury as compared to a human amalgam which averages 780 milligrams per filling for an average amalgam. They carved them so they're concave to avoid excessive abrasion of the filling material. Once again, 1 out of every 10 molecules were labeled radioactively. Here again, it doesn't occur in nature, so there's no need for controls. Any mercury they found, radioactively labeled mercury they found in the animal's body had to come from the fillings, couldn't possibly come from anywhere else. Once again, they left it in only 29 days, sacrificed the animal, cut the teeth off at the gum line, removing the crowns of the teeth and along with the mercury fillings, and did a whole body scan. Here's what they saw on the monkey. On the left, you have the ventral image. In the middle, you have the dorsal image, and on the right, you have the dorsal image after removal of the GI tract. The GI is the gastrointestinal system, the K are the kidneys, and the J is the jaw tissues after the teeth are removed. And here again, using the cesium background with a low penetrating radioactive source, you can see the outline of the animal. Then you see these little dots all, if you were close or you've seen this, you can see little black dots all over the animal, all through it. Each dot representing 1/10 of the mercury in that location, and then of course certain locations where there are more black dots than others, namely the GI tract, the jaw, and the kidneys. And then again, they measured with scintillation counting the amount of mercury found in these tissues, and they found once again that in the monkey, the same thing that they found in the sheep, that mercury from dental amalgam fillings within 29 days enters the body, and the major uptake sites are the lung, the jaw tissue, and the gastrointestinal tract. And then once again, in nanograms per gram, with lower, slightly lower, but in the same range of levels found in the sheep, because the monkey is not a ruminant and they could control its feeding to 2 meals a day. They found lower levels, but still in the same ballpark. The highest levels in the monkey, however, were found in the alveolar bone, first of all, then the gingiva, and then the kidney. There were substantial levels of mercury from the amalgam in the tongue, the liver, the oral mucosa, and the pituitary gland. And then other depots were the knee joint membrane, the adrenal, the pancreas, the spleen, the lung, the testes, the trachea, the brain tissue, and then the heart. They also found that the levels of mercury found in the whole blood and urine were lower than the levels of mercury found in most of the body tissues. In their discussion, they concluded that when amalgam fillings, which normally contain approximately 50% mercury, are made with a tracer of radioactive 203 mercury and then placed into monkey teeth, the isotope appears in high concentration in various organs and tissues within 4 weeks. The advocacy of the dental profession that mercury-based silver amalgam is stable and systemically biocompatible is not supported by these animal studies. Then they concluded, now that it has been established that mercury vapor is continuously released from amalgam fillings in human teeth, and that specific loci in the sheep and monkey will concentrate large amounts of this mercury, the possible pathophysiological consequences of such exposure must be addressed, which is exactly what they did. But before I get into that, I want to show you a study collaborating these tracer studies only done by a separate research group in a entirely different separate location by an entirely different technique. This study was done by Danscher et al. In Denmark, and it was published in 1990. Instead of using radioactively labeled mercury, this group at the Royal College of Dentistry at Aarhus in Denmark took 3 monkeys and placed occlusal amalgams totaling 0.7 to 1.2 grams. They also took 3 other monkeys and implanted amalgam into the alveolar bone, simulating retrograde amalgam fillings. And then they used 3 untreated control monkeys. They left these amalgams in for 1 year. Then they sacrificed the animals, and instead of using a radioactive technique, they used autometallography with light and electron microscopic analysis of the tissues. And here's what they found. They found in the amalgam subjects that there was mercury deposition in the spinal ganglia, in the anterior pituitary, in the adrenal medulla, in the liver, the kidneys, the lungs, and the intestinal lymph glands. In the bone implant monkeys, they found mercury deposition in the spinal ganglia, in the anterior pituitary, in the adrenal medulla, and in the kidneys. In the control tissues of the monkeys with neither, there was no mercury in any of the tissues. Their conclusion was that these results strongly support what has been suggested previously, that dental fillings in primates cause absorption of mercury released from amalgam fillings through the lungs and the intestinal tract, and that depending on the exposure route, mercury is distributed to most organs and will eventually be found in the central nervous system. So now what we have then, 2 separate research groups, 2 different locations, both medical schools, both using 2 different techniques, finding the same thing, that mercury from the amalgam fillings rapidly leaves the fillings, enters the body, builds up in certain locations. Now, there's something very significant about this study here, and that significance is this. Let's look for a moment now at the findings of those 3 monkeys that had amalgam fillings compared to those 3 monkeys that had the amalgam implanted in the bone, simulating retrograde amalgams. What do we find? We find that in both cases, there's mercury in the spinal ganglia, there's mercury in the anterior pituitary, there's mercury in the adrenal medulla, and there's mercury in the kidneys. But in the bone implant animals, there was not mercury in the lungs, in the intestinal lymph glands, right? Okay, so what is this showing us? This is showing us that mercury can pass from the oral region into the pituitary, adrenal, spinal ganglia, and kidneys without entering the body through inhalation or ingestion. Isn't that what this is demonstrating? This is very interesting, because back in the 1920s and 30s, a chap in Germany by the name of Alfred H. Stock demonstrated that mercury from dental amalgam fillings passes directly into the pituitary and hypothalamus region via, most likely, the axon transport system of the nerves and the valveless veins. The axon transport system had been well demonstrated for thallium and other metals, but not for mercury. Yeah. Then, in 1985, Patterson in New Zealand found that there was mercury from dental amalgam fillings in the nasal cavity as well as the oral cavity. So that if you're breathing through your nose, you're getting in through the nasal tissues as well. Nylander at the Karolinska Institute in Stockholm, Sweden, found that dentists in autopsy studies had extremely high levels of mercury in the pituitary glands. All right, what's this all leading to? This is all leading to the possibility that not only does mercury from dental amalgam enter the body through the lungs by inhalation, but also by another route, which is absorption through the oral nasal mucosa and then passage to the nervous tissue, either through the axon transport system or through the valveless veins of the skull, or both. And guess what happened in 1990? Arvidsson in Denmark conducted a study published in the Acta Neurological Scandinavia. What he did is he took mice and he injected small amount of mercury chloride dissolved in water in the vibrissae muscles alongside the nose. And then, once again with autometallography, analysis of the tissues found that mercury was found in the brainstem and kidneys within 1 to 6 weeks after injection alongside the nose. Very interesting. Then, he found in this particular study that the mercury accumulated in the neurons of the facial nerve nuclei, the motor trigeminal nuclei, and the trigeminal mesencephalic nuclei of the brainstem. He also found it in the mercury in the proximal tubular cells of the kidney, and determined that there was a possible significance of these findings to the retrograde axonal transport of mercury that had been well demonstrated for thallium and other materials, and discussed its significance to motor neuron disease, like Lou Gehrig's disease, ALS. Then what he did in the next study, Arvidsson, and I'm sorry, I don't know whether this is husband and wife or what, but they also, next, they took adult rats. They exposed the pulp cavity of the upper right first molar. They unilaterally, on one side, injected approximately 1 microliter of mercury chloride into the molar. And once again, with autometallography, they analyzed the tissues after 1 to 24 days in these animals, and they found that the mercury that they had injected into the tooth accumulated in the neurons of the trigeminal ganglia on the same side by retrograded axonal transport. So it's no longer theory. Stock's work and Stortebecker's work has now been scientifically demonstrated that mercury in the oral nasal region will go to the nerve tissues via the axon transport system. And that's the thing that the Dancer study demonstrated, that the Calgary study did. All right, now that it has been scientifically determined, published in the literature, in the peer-reviewed literature, that mercury does exit the filling, the amalgam fillings, it does enter the body, it does go to specific locations. Let's see now what it does, if anything, in the body. This was published in the American Journal of Physiology in October of 1991. The abstract was published in August of 1990 because the findings were so dramatic. The dental profession criticized these findings because it was only an abstract form. Dentists have a hard time understanding, I guess, that medical science, when an abstract is published in medical science in a valid journal, it's going to be followed by the full study. This does not happen in dentistry. I know. My father and I get the Journal of Dental Research every year, and every year the Journal of Dental Research has 3,000 or 4,000 abstracts that we go through every year, at least. Very few of which become full studies. But that isn't the way it works in medicine. When you have an abstract published in a valid scientific journal, it's going to be followed by full data. The findings were so dramatic, they published the abstract in August of 1990, and the full study finally came out in the American Journal of Physiology in 1991, one of the top peer-reviewed medical journals in the entire world. This study was evaluated by the top nephrologists in North America, period, without question. They made sure. It's entitled, Mercury from Dental Silver Tooth Fillings Impairs Sheep Kidney Function. All right. I hope you can see this. The protocol in this study was this. They took 8 adult ewes, each with about 48 kilograms of body weight. In 6 of these sheep, they placed 12 occlusal amalgams, each with 425 milligrams of mercury, which is about half the size of an average amalgam filling in the human adult. In the 2 control sheep, they placed 12 glass ionomer fillings. Now, in order to evaluate kidney function, there are numerous ways you can do it. The most accurate way of doing it is inulin clearance. Well established in the scientific literature, so they used inulin clearance. They conducted inulin clearance tests on these animals 2 days before placing the fillings, and then 30 and 60 days after in the case of the amalgams, 30 days after in the case of the glass ionomers. They also did before and after plasma and urine electrolytes, urea, and protein measurements. The results were this. The results of the present study let me move to the next slide first. These are the data right here. On the horizontal axis, you see the number of days. On the vertical axis, the inulin clearance levels. And at -5 days or -2 or 3 days is when the experiment started. 0 is when the fillings were placed. The solid line are the 6 animals with the amalgams. The dotted line are the 2 animals with the glass ionomer fillings placed in. And the inulin clearance levels were compared to a number of other previous studies on sheep. And the initial findings were in the range of what were found in these other studies. Shortly after the amalgam fillings were placed, the inulin clearance began decreasing until at 30 days it was approximately 50% of the original levels, and at 60 days it was another 10% down. In the case of the glass ionomer fillings, the level went down only very slightly, not significantly. As you can see, the bars there, that's a standard evaluation of the means, and they overlap, so it's not statistically significant. All right, the conclusions on this study then, where the results of the present study demonstrate that mercury released from dental silver amalgam will significantly reduce the plasma inulin clearance rate of the kidneys by more than 50% within 1 month after placement of these tooth fillings. By 2 months after placement, the urine albumin concentration falls significantly, and during the same period, concentrations of sodium increase significantly. This finding is indicative of impaired tubular reabsorption. They also concluded that the observed findings and the alterations in renal function are due to a subtle subacute effect from chronic low-dose mercury exposure rather than acute nephrotoxicity, and this is very important. Because here is the actual data on their findings of the measurements of the various levels. Now, if we can look on the right, at the right column, you'll see 2 starred columns, sodium and albumin. Notice that during the short course of the experiment, 60 days, the levels of the sodium in the urine were significantly increased. The levels of the albumin in the urine were significantly decreased. Now, there was a study conducted. Do I have it? Yes, I have it. I'll get to that in a minute. The criticism of this particular study within the dental profession is that the levels of alkaline phosphatase and the levels of gamma glutamyl transferase did not alter, therefore there was no effect. Well, any nephrologist knows, dentists don't know this, but nephrologist knows that these are indicators of acute mercury nephrotoxicity, not chronic mercury nephrotoxicity. That's well established in the scientific literature. So the criticism is totally invalid. The other factor here that's very important is that this has been confirmed in a human study, this effect. Look at the levels of the albumin that decreased after placement of the mercury fillings. And now let's look at yes?
Mike, wasn't that the reasoning that at the FDA hearing last March, nephrologists?
Yes, yes. The people who testified against this particular research study at the FDA meeting last year said that the levels of gamma GT and alkaline phosphate did not change, therefore there was no harmful results, and that's ridiculous because the scientific literature clearly shows these only change during acute mercury exposure, not chronic. The changes that occur in chronic mercury exposure are the albumin changes primarily. And also, there's another one that I can't think of right now, sorry. Okay, so in 1990, this was published in the Swedish Dental Journal, a study by Molin. It was a 4-part study. One of the parts was that Molin and associates, or Molin actually, took 10 healthy subjects with a mean number of 19.9 surfaces of amalgam compared these, removed the amalgams on these 9 people, or 10 people, and compared them to 10 controls with a mean of 24.7 surfaces. And then did blood and urine mercury samples before and after removal, etc., and other tests, and concluded there were no harmful effects. Well, apparently Dr. Moline, who's a dentist, didn't realize that one of the harmful effects of chronic mercury exposure is the reduction of the ability of the kidney to pass the albumin, and then you'll have the different change in the albumin levels in the urine. Because what she found in these subjects was after the amalgams were removed, there was a significantly higher mean urine albumin value in the subjects 12 months after amalgam removal, which confirms what the Calgary group found in the sheet by placing amalgams and finding a lower mercury albumin level in the animals. Okay. Now, after the first study was published in the FASF journal, a researcher at the University of Georgia, who is a PhD microbiologist and one of the world's foremost experts on gastrointestinal flora and the effects of mercury on the causing what's termed multiply-resistant bacteria, read the FASF journal, picked up the phone and called Calgary and said, bingo. She and associates had been studying this phenomenon for 12 years, I believe, and couldn't figure out where the heck the mercury was coming from. So arranged with Calgary to do some group studies. Calgary had the monkeys, took the samples, sent them to Georgia. Dr. Summers and her group then evaluated these for their effect on the bacteria of the gut and the oral cavity. In the first study, which was published also in abstract form in the Physiologist in August of 1990, 2 monkeys were evaluated. Each of these 2 monkeys had 16 occlusal amalgams. The Calgary team took daily duplicate gingival and fecal microbial flora samples to send to Georgia for analysis, and this began 10 days before the amalgams were placed and continued until 30 days after the amalgam were placed, so that these animals served as their own controls then, before and after amalgams. And then the Georgia researchers then evaluated the bacterial flora in the gut and the oral cavity for their resistance to mercury and to antibiotics as well. That's the multiply resistance. And they found there that mercury resistance was undetectable in the gastrointestinal bacteria until the 10th day after the placement of the amalgams. Then these animals showed an average of 30% of mercury-resistant bacteria in the gingiva and fecal flora. They concluded that there was sufficient mercury available to affect the gingival flora and the fecal flora, that the resistant bacteria converted inorganic mercury to mercury vapor for their own protection, for the bacteria's protection, thereby increasing the bioavailability of that mercury to the host organism, namely the monkeys, because mercury vapor, being lipid soluble and having no electrical charge, passes cell membranes and penetrates into the body tissues very readily. They also found that 80% of the bacteria that were resistant to mercury were resistant to tetracycline. In the next step in this experiment, reported to the American Society of Microbiology in 1991 at the annual meeting, 2 additional monkeys were evaluated. Once again, each one was 16 occlusal amalgams, and once again the samples were taken daily and sent to Georgia, and started 10 days before the amalgams were placed to 2 months after the amalgams were placed, and then the amalgams were replaced with composite for another 2 months further analysis. And once again, the resistance to mercury and various antibiotics this time were determined. Here's what they found. An average of 30% of the bacteria were resistant to mercury. This is the bacteria from the oral cavity and the gastrointestinal tract. 80% of those bacteria that became resistant to the mercury also became resistant to ampicillin, tetracycline, streptomycin, and erythromycin. 30% of the multi-resistant bacteria could transfer their resistance to antibiotic-sensitive strains through the plasmids, which are these DNA spicules that are not in the nucleus, they're in the cytoplasm of the cells. Their conclusion at this point was, it is likely that dental amalgam mercury is a selective agent which increases the prevalence of plasmid-associated mercury and antibiotic resistances in the oral and intestinal bacteria of humans. That such resistance plasmids can compromise the effectiveness of antibiotic therapy used in the treatment of bacterial infection has been documented by many investigators over the past 25 years. So, we have a very significant situation now, in that it has now been demonstrated and reported that mercury from dental amalgam fillings can harm the individual before the mercury enters the body. Doesn't even have to enter the body and it's harming the host already. We have now come to the point, or they have come to the point where they've done additional 2 more monkeys. That's been completed, additional findings. It's now being prepared for final publication, which will be out, is my understanding, in the next several months. Okay, now, in February of 1992, excuse me. February of 1992, there was a meeting held in Seattle, Washington of the Society of Toxicology, their 31st annual meeting or 33rd annual meeting, and one afternoon was devoted to presentations on dental amalgam mercury. One of these presentations was by Mats Berlin from Sweden, one of the 3 or 4 top mercury toxicology experts in the world, PhD toxicologist. Dr. Berlin reported to the Society of Toxicology, and it's published, that of 2 studies that have been completed in Sweden, one at Uppsala University, one at the University of Lund. And in one of the studies, at the Lund study, pregnant squirrel monkeys were exposed to mercury vapor 3 and 6 hours a day for 5 days a week. And in the babies that were born to these mothers, there was early abortion, premature birth, low birth weight, perinatal death, fetal blood, and the fetal blood mercury contents were dramatically high at birth. They were 5 times the levels of the babies that were found in the mothers. In the study at Uppsala, conducted on pregnant rats exposed to mercury vapor, there were persistent behavioral deviation of the babies as compared to controls. And this also occurred even after neonatal exposure to the mercury vapor. So that's been now reported by qualified medical scientists. In another study reported at that same meeting by Rowland and Associates at Medical Research Triangle, which is a US EPA group in that area, they conducted a study on California dental assistants, a very, very broad study, and compared the fertility of these dental assistants and as compared by the factors involved to their mercury exposure, including their mercury hygiene in the office, the number of amalgams they placed a week, and various other factors were ruled out or controlled for, rather, including age, smoking, intercourse frequency, history of pelvic inflammatory disease, the year the attempt to become pregnant began, the occupational exposure to cold sterilants, x-rays, and nitrous oxide were all controlled for, and they found that the female dental personnel preparing more than 30 or more amalgams a week and had 3 or more poor mercury hygiene factors took longer to become pregnant. The probability of conceiving was 50% compared to 90% for the non-exposed workers, and they are now at that group conducting additional studies on dental personnel as well as patients now. So, and then also the other work at the Calgary studies and the Georgia studies were reported at that meeting as well by Dr. Fritz Horscheider of the Calgary team. So it's in the, this is out of the hands of the dental community now. It's in the hands of the medical scientific community. So I fear that dentistry has lost its autonomy and control because of our positions on this particular subject. I would like now to show you some information on Dr. Fisher. I have 17 minutes left. Where do you want me to go from here? You want me to continue in this, continue in this vein and not cover the other material?
Like the FDA rules?
Yeah.
What, sure.
Will you want me to cover the remaining pathology that I have, or do you want me to go into the legalities of the use of dental amalgam?
Short lunch.
Yeah, we'll shorten lunch a little bit. Talk faster.
Talk faster. You want me to continue with this right now?
Confusing us with facts, just get the point.
Okay, fine. I won't confuse. I'll try not. I'm trying not to confuse you with facts. In the early 1980s, a research group at Massachusetts reported high levels of aluminum in the brains of victims of Alzheimer's disease. Subsequently, a group at the University of Kentucky School of Medicine, Sanders Brown Aging Center, Departments of Chemistry, Physiology, and Pathology began doing experiments on Alzheimer's victims, humans, with instrumental neutron activation analysis, which is not only extremely accurate, but you can determine a number of metals at the same time, not just one. The tissue's not destroyed. And in their first study, published in the Neurotoxicology Journal in 1986, they found that the highest samples in the Alzheimer's whole brain samples compared to controls was of mercury, not aluminum. Actually, the mercury levels were 31.4 nanograms per gram versus 17.5 in controls, almost twice as much. They concluded from this first study that the possibility of an etiological role for trace elements in Alzheimer's disease clearly deserves further investigation, which is what they did. In their next study, they went to the regions of the brain that were particularly damaged in Alzheimer's disease, and particularly the nucleus basalis of minor, which is the main area. It's a cholinergic projection into the brain. And this is the area where most of the neurofibril tangles are found in Alzheimer's victims. And they measured the metals in these areas with instrumental neutron activation analysis, and they found that there were significantly increased levels of mercury in the Alzheimer's disease nucleus basalis of minor, 39.9 nanograms per gram versus 8.9 nanograms per gram in controls, and to a lesser degree in the amygdala and the hippocampus. All right, that's 4 to 5 times more mercury than in the victims than in the controls, and they stated that this is the largest, to their knowledge, difference ever found in any study conducted on Alzheimer's victims. They stated in this study, the source of the mercury in the brain is not known, although environmental pollution and dental amalgams have been widely suggested. In their next study, they went right down to the cellular level and measured the amounts of 13 different metals by INAA, and they found that the greatest alteration was of elevated mercury in the microsomes and increased mercury-selenium mass ratio in the nuclei and microsomes. They concluded after this third study, published in 1990 in the journal Brain Research, that the present study suggests that the elevation of mercury in Alzheimer's disease is the most important of the imbalances we have observed, that the source of the mercury, brain mercury in Alzheimer's disease is not known, although dental amalgams and environmental sources such as seafood are potential sources. This and our other previous studies suggest that mercury toxicity could play a role in the neuronal degeneration of Alzheimer's disease, and the extreme elevation of mercury in the nucleus basalis of minor could relate to the severe degeneration of the nucleus and to the cholinergic deficit in Alzheimer's disease. Well, at the same time, now, another research team at University of Kentucky, a different team, began animal studies. And they try to determine if the high metals found in these human autopsy studies could cause the type of damage found in Alzheimer's disease. So what they did is they selected tubulin, which is a protein in the brain tissue, which is a necessary precursor for the formation of normal neuronal matrix. If the tubulin was there and functioning properly, then a normal neuron would be formed. If the tubulin was blocked or not functioning properly, the result would be the neurofibril tangle as is found in Alzheimer's disease. So they gave mercury and they gave aluminum to rats. And they tested it by SDS page and auto radiography with GTP photolabeling, which is how you determine if the tubulin is there and functioning properly. And they found that when they gave mercury to the rats, that it abolished the GTP tubular interaction just as is found in Alzheimer's disease. When they gave these rats aluminum, it didn't happen. The aluminum did not cause the damage. The mercury did. They concluded that these results suggest that certain complex forms of mercury must be considered as a potential source for the cause of Alzheimer's disease. The University of Kentucky then applied for a grant from the federal government, from the National Institute of Aging, to directly investigate whether or not mercury from dental amalgam fillings is involved with Alzheimer's disease. They were awarded $780,000 for this study last September. Now, I want to say just a few things. There's a lot of things in the scientific literature. Obviously, I can't tell you everything. I'd like to talk for just a brief moment about this. This is the Encyclopedia of Occupational Health and Safety. It is a toxicology reference for the World Health Organization. This is the 1983 edition of this. In this document, for inorganic mercury, chronic poisoning by inorganic mercury, the nervous system effects are such, quote, nervous system involvement may occur with or without gastrointestinal symptoms and may evolve in line with two main clinical pictures. A, fine intention tremor reminiscent of that encountered in persons suffering from multiple sclerosis, and B, Parkinsonism with tremor at rest and reduced motor function. This toxicology reference goes on to state that the most frequently encountered symptoms for chronic exposure to inorganic mercury effects on the nervous system resemble those presented by persons with multiple sclerosis. The most striking feature is tremor, which is usually a late symptom, but may develop prior to stomatitis. Mercurial Parkinsonism presents a picture of anemia, unsteady and staggering gait, absence of balance, recovery reflexes, and hypotonia. Now, there are beginning to be scientific studies published directly investigating this potential connection. What this reference book is saying then, that nobody knows what causes multiple sclerosis. There's no known treatment for it, but what is known is that chronic exposure to inorganic mercury can mimic it. It's right in the reference book. Now, an example of some of the things that are beginning to appear are like this by Dr. Britt Ulrich Westerlund in Sweden, who took 12 subjects with neurologically verified multiple sclerosis and compared them to 14 controls and measured the mercury levels in the cerebral spinal fluid and found the mercury levels in the cerebral spinal fluid to be 7.5 times the mercury levels found in the controls without multiple sclerosis. Dr. Ulrich Westerlund concluded that the toxic effects of mercury on the central nervous system seem to be in accordance with the clinical picture of multiple sclerosis, and the detrimental effects of mercury may be caused in two ways. One should be by direct intoxication of the nerve cells, and the other by causing an angiopathy in the venules surrounding the myelin sheaths in the CNS. My cardiovascular presentation goes into this very thoroughly about the mercury, the way mercury damages the blood vessels, which is what leads to the neurological damage. It's the mercury damage to the blood vessels that causes the neurological damage. But I don't have time to get into all that. Then, in 1989, there was a study published, conducted in Singapore by Ngim and Devison, a case control study of 54 subjects with Parkinson's disease compared to 95 matched controls, measuring levels of mercury in the blood, urine, and hair, which do not correlate to body burden and toxic effects, of course, but can correlate to exposure. And they found in this particular study that there was a correlation between the urine levels and the blood levels, and less so for the urine levels, with the Parkinson's disease. And that they considered all the factors, including the dental amalgam fillings. So they found a connection. Now, the reason I show this slide is because there are several other studies, Karzanskis and a few others, who have who have done studies on Parkinson's disease victims and found connections to mercury levels in the body. So there are several studies on the Parkinson's disease, but I don't have time to show everything. Then we have this done at the Heavy Metal Center in Sweden, in Uppsala, in Sweden. Lindvall and Associates published in 1988, or reported in 1988, where they studied 27 subjects with chronic malaise, compared to the 27 healthy controls, and did Epstein-Barr virus serology testing, and also with micropixa. Pixa is proton or particle-induced X-ray emission. With this technique, you can look right in a cell, and you can see if there's a metal in that cell with micropixa. So by using micropixa and Epstein-Barr virology testing and matching them, they found that the subject of chronic malaise had significantly increased Epstein-Barr virus antibody titers compared to the controls. They also found mercury in 80% of the cells of the victims, whereas there were no mercury in any of the cells of the controls without the chronic fatigue syndrome. Their conclusion was that their serological results compare well to findings presented by other investigators in the field of chronic active Epstein-Barr virus infections. There was an abnormal presence of mercury in the blood cells, that mercury, a heavy metal with known toxic properties in even minute quantities, has immunomodulatory effects in mammals, and that their findings of intracellular mercury in cases with apparent evidence of an immunoregulatory dysfunction warrants further elucidation, which is exactly what's going on over there. This group of medical researchers is now conducting a broad study of immune parameters compared to mercury and related to dental amalgam fillings. This is not in the dental profession, this is in the medical profession. Another example how we in the dental profession, because of our handling of this issue, have lost control of this issue. It's out of our hands now. No, it doesn't matter what we say anymore. The medical scientists have settled it. It's no longer a matter of scientific debate, it's only political now. So, now, we are now on to that particular discussion. The political aspects of this, perhaps even the legal aspects of it. So, let's start on that. I'd like to now address the professional considerations for the use of dental amalgam. Where exactly are we on this? I mean, there's a lot of opinion. A lot of people are saying things. What people say is not nearly as important as what has been documented, so I would like to show you what has been documented. Let's start here with ADA patient pamphlet W186, 1985, dental amalgam serving the public well. Quote, scientific studies of dental amalgam in tooth restoration have been carefully conducted for more than 100 years. There is no scientifically sound evidence of linking amalgam restorations to any general medical disorder. Quite the contrary, amalgam restorations continue to be shown safe for the vast majority of dental patients. Unquote. In another place in that same pamphlet, quote, 150 years of experience with dental amalgam have proved it to be safe as an essential means of filling patient health care needs. Well, that was in 1985. By 1990, the position of the American Dental Association had changed. Scientific studies of dental amalgam and tooth restoration have been carefully conducted for more than 100 years has been dropped. That is no longer in the policy. Here is the official position of the American Dental Association as of April 1990, as published in the Journal of the American Dental Association. Quote, the strongest and most convincing support we have for the safety of dental amalgam is the fact that each year more than 100 million amalgam fillings are placed in the United States, and since amalgam has been used for more than 150 years, literally billions of amalgam fillings have been successfully used to restore decayed teeth. Not a mention of scientific research. None. That's been all dropped. This position is anecdotal to the extreme. This position is not scientific. It is not professional. And when you take into consideration the severe toxicity of mercury, it is not even ethical. And I'll show you why. Why did the ADA change this? Well, we have to go back to 1984, when a group of dentists initiated a dialogue with the American Dental Association through an attorney. The attorney wrote to the ADA on November 30th of 1984 with this request: my clients hereby call upon the American Dental Association and its elected officers to either produce the primary pathological research proving that the mercury released from dental amalgam is not harmful to patients, or call for a moratorium on the use of dental amalgam until such research can be produced. Not an unreasonable request, since they said they had 100 years of it. Well, the ADA legal department started writing this attorney back and forth and saying, who are your clients? The attorney says, I have no obligation to tell you who my clients are. Answer my question. You know? Finally, they answered his question in February of 1985, and here it is. From the legal department of the American Dental Association, I quote to you, as you must know, the ADA is not a regulatory agency, and therefore cannot declare a moratorium on the use of any product or agent in dentistry. That type of action could only be carried out by the Food and Drug Administration or some other appropriate agency. True, the ADA is a trade union. We all know that. They have no authority, no legal authority. Okay, but they do have a certification program for dental materials. And that certification program was discussed in early in 1986 in the ADA News. And in that it said that the requirement is that every 3 years the ADA must review the current scientific documentation justifying the certification of its products. So we wrote to the ADA in early 1986 and we said, we'd like you to present to us the scientific documentation published in the past 3 years that justifies the continued certification of dental amalgam, and boy, did we get a shock. Here's a letter we got from the ADA, quote, dated May 22nd, 1986, quote, there appears to be confusion regarding both the role and of the council and the scope of ANSI ADA specification number 1 for alloy for dental amalgam. The specification is not for dental amalgam. It is only for the alloy for dental amalgam. The amalgam does not form until the dentist mixes the alloy with mercury. Therefore, dental amalgam per se cannot be certified. We cannot certify a reaction product made by the dentist. Now, we happen to know that the ADA does certify dental cements, dental impression materials, and later on even dental composites, which are also reaction products mixed in a dental office. So, but this really took us by surprise. We couldn't believe it. So we started investigating this, and I want to read to you and have you remember the name of the person who signed this letter, because you're going to hear it again. John W. Stanford, Ph.D., Secretary, Council on Dental Materials, Instruments, and Equipment, American Dental Association. We have this letter with his signature on it. Now, the first thing we did is we said, well, it appears that Dr. Stanford is saying that they won't certify amalgam because it's a reaction product, yet they certify all these other reaction products. The second thing that caught our attention is Dr. Stanford is saying that the responsibility for anything that happens with dental amalgam once its components are mixed is not theirs, it's the dentist who mixed it. It's their responsibility. In other words, the ADA is bailing out and leaving the dentist to hang. All right. The third thing that interested us was, what the heck is ANSI? So we called the ADA and say, who's ANSI? And they said, well, ANSI is American National Standards Institute. Well, you know, where are they? They're in Philadelphia. Here's their phone number. We called ANSI and American National Standards Institute in Philadelphia, Pennsylvania, and I asked them, what branch of the U.S. government are you? Oh, we're not a branch of the U.S. government. Well, what are you? We're a private corporation. Well, what do you have to do with dental materials? The American Dental Association hired us to develop American National Standards. Now, American National Standards, ANS, sounds really official. These are standards, listen to this is important. Standards developed by a private corporation hired by a trade union. This is real important in just a minute. I'm going to tell you why. So we got all this anti-ADA stuff. And their main document is anti-ADA document number 41. I'm going to read the title of that to you twice because it's important. Quote, for recommended standard practices for biological evaluation of dental materials. For recommended standard practices for biological evaluation of dental materials. And sure enough, this document has the requirements, including requirements for biocompatibility tests. And sure enough, it's got dental amalgam in there under 1A, restorative materials, metallic. And sure enough, it requires 7 biocompatibility tests for the certification of dental amalgam. Nowhere in anti-ADA document number 41 does it say alloy for dental amalgam. Nowhere does it say dental mercury. It only says dental amalgam. And yet, Dr. Stanford told the truth. There is no ADA certification for dental amalgam. There is ANSI, ADA specification number 1 for alloy for dental amalgam, ADA, ANSI ADA specification number 6 for dental mercury. Neither one of them has any requirements for biocompatibility testing. None whatsoever, and there is no certification of dental amalgam once it's been mixed. But the ADA does have a document for mixed dental amalgam. It really does. And this document was promulgated by that very same Council on Dental Materials, Instruments, and Equipment, headed by that very same John W. Stanford, PhD, published in JADA, Volume 109, October 1984, pages 617 to 9. And here's what it says, and these are quotes. All amalgam scraps should be salvaged and stored in a tightly closed container. The scrap should be covered by a sulfide solution such as X-ray or photographic fixer solution. A no-touch technique of handling amalgam should be used. Direct contact or handling of mercury, amalgam, or other mercury-containing materials should be avoided. Skin that is exposed to mercury should be cleaned. Precapsulated alloy should be used. Water spray and high-volume evacuation should be used when removing old or finished new dental restorations, and these should be passed through filters, strainers, or chaps. A face mask should be used. The office should be monitored, etc. Now, this is the official ADA document on mixed dental amalgam. Why would these have to be done if the amalgam is safe or harmless or has no risk? There is only one way you can read this document. Mixed dental amalgam is a toxic hazard in the dental office, and so is mercury. Now, the ADA says it has no authority to regulate any dental materials, and that authority rests with the Food and Drug Administration or some other appropriate agency. Well, there is no other appropriate agency. Only the Food and Drug Administration has the authority or the responsibility for regulating dental materials. And that authority dates to 1976. Understand this, that all official actions and positions of the Food and Drug Administration must be published in the Federal Register. If they're not published in the Federal Register, they're not official actions, period. So everything I am going to read to you now comes directly out of the Federal Register, because there are a lot of things that have been said about the Food and Drug Administration. A lot of opinions have been given. These are the documented facts. No opinions whatsoever. First of all, on May 28, 1976, the President of the United States signed into law the Medical Devices Amendments to the Food, Drug, and Cosmetic Act, which gave the Food and Drug Administration not only the authority, but the responsibility to, quote, assure the safety and effectiveness of medical devices intended for human use. That's the direct quote from the Federal Register. Then the FDA set up rules and policies for evaluating the safety and effectiveness of all devices intended for medical use. These rules and procedures were published in the Federal Register, clearly. The FDA also set up a series of panels for different branches of medicine, including one for dentistry. The Dental Devices Panel was charged with the responsibility to assure the safety and effectiveness of all dental devices intended for human use. Now, the rules and procedures as published in the Federal Register state that all these devices must be placed in one of three categories. Class 1, entitled General Controls, Class 2, which required performance standards, and Class 3, which required pre-market approval. As published in the Federal Registry, those devices placed in Class 1 for General Controls, quote, are devices that do not impair human health or even present a potential risk of illness and injury. Only those devices could be placed in Class 1. In Class 2 were devices where general controls alone were insufficient to provide a reasonable assurance of safety and effectiveness, and there must be documentation to establish performance standards for the devices to ensure that the risk was low. In Class 3 were those devices where there was insufficient information to establish a performance standard or which presented a potentially unreasonable risk of illness or injury, and which would then require documentation for pre-market approval before they could be accepted by the Food and Drug Administration. This is all taken from the Federal Register. This is all documented fact. The FDA further stated that any device that was an implant must automatically be placed in Class 3. Had to be. And defined implant, as published in the Federal Register several places, as, quote, a device that is placed into a surgically or naturally formed cavity of the human body. Right from the Federal Register. The Dental Device Panel realized that dental amalgam fits into this category of implant. It is documented that the Dental Device Panel petitioned the Commissioner of the Food and Drug Administration to specifically exempt dental amalgam from the implant category, therefore avoiding the Class 3 or pre-market approval category. It is documented that the Commissioner of the Food and Drug Administration declined to do so, which now explains the actions from here on of the Dental Device Panel. And at this point, we should look at the Dental Device Panel, and this was published in the Federal Register, Volume 40, number 97, pages 21848 to 51, May 19, 1975. 9 people were placed on the Dental Device Panel. There was a liaison from industry. There was a consumer liaison, a certified dental technician, a DSC dental instructor, Floyd Payton, 4 dentists, and the chairman of the Dental Device Panel, John W. Stanford, PhD. And yes, that's the same John W. Stanford who was at that time and still is the chairman of the ADA's Council on Dental Materials and Equipment. Now, mind you, this panel of experts were to determine the safety and effectiveness of all devices to be used in dentistry. Now, what does safety mean? Does this mean it has no systemic effects? Well, if it has no systemic effects, perhaps it would have been better to have at least one toxicologist or physiologist or even MD on the panel. As it turns out, there were 4 dentists and 5 lay people on the panel. No toxicologist, no physiologist, no MD even on this panel, and yet they were to determine the safety and effectiveness of all devices to be used in dentistry, intended for human use. And this explains their violation of FDA rules, the first of which occurred on August 12, 1976, on page 34100 of volume 41 of 157 of the Federal Register, it states this, quote, right from the Federal Register, voluntary or privately recognized performance standards will not be a substitute for the formal promulgation of standards under Section 514 of the Act, that's the Food, Drug, and Cosmetic Act, for any device that is classified in the performance standard category. That's Class 2, right? On the very next page, page 34101, were the activities of the Dental Device Panel, and they were this, quote, in 1973, EDA identified as acceptable the 7 dental material standards listed below that were developed by the American Dental Association and promulgated as American National Standards, ANS. The standards were presented to the FDA Classification Panel on Dental Devices, which recommended that the FDA accept them as standards, and there was ANSMD 156.1, which is for dental amalgam alloy, and ANSMD 156.6, standard for dental mercury. So the Dental Device Panel immediately violated the FDA rule on the previous page. Back then, they went on to continue these violations when in 1980, the Dental Device Panel presented its proposed classification of dental devices to be accepted as safe and effective for human use. In the Federal Register, on that particular page, their recommendation was for amalgam alloy. Proposed classification of amalgam alloy in Class 2 requiring performance standards because, as they listed in the Federal Register, there were risks to health which included adverse gastric or respiratory response, and B, adverse tissue reaction. Now, to be placed in Class 2, the FDA requirement was, if there are going to be performance standards, that you have to have documentation, scientific documentation for these performance standards. Here in the Federal Register, I am going to quote to you directly from the Federal Register the summary of data on which the recommendation is based. Quote, the panel based its recommendation on the members' personal knowledge of and clinical experience with the device in the practice of dentistry. That's a violation of FDA rules, first of all, right there on the safety. But what about the effectiveness? The Dental Device Panel, in recommending the acceptance of amalgam alloy as a certified or classified dental device as being effective. Impossible. No dentist ever has or ever will place amalgam alloy and use it as a device. It can't be done. It's a reaction product with something else. All right. In that very same Federal Register, the Dental Device Panel again violated FDA rules by recommending the acceptance and classification of dental mercury in Class 2. It even listed the risks to health in the Federal Register, being mercury poisoning and adverse tissue reaction. And in the summary of data on which the recommendation is based, it stated, quote, the panel based its recommendation on the panel members' personal knowledge of and clinical experience with the device in the practice of dentistry, and on the article published in the Journal of the American Dental Association entitled An Environmental Study of Mercury Contamination in Dental Offices, JADA Volume 89, which has nothing to do with patients whatsoever. So that's a violation as well, plus the fact the Dental Device Panel recommended the certification and classification and acceptance of dental mercury as an effective dental device. No dentist ever has and ever will use dental mercury as a dental device. It has to be mixed with something else before it's a dental device. So it's neither safe nor effective. Now, at this point, the FDA rules say that this doesn't become law of the land until there's a 3-month waiting period for comments. Well, 3 months passed, 3 years passed. Finally, in 1986, we wrote to Dr. Gregory Singleton and asked him, what's the status of dental amalgam? You know, you haven't done anything. classification regulations have not been published, but are expected to be completed sometime in 1986. Well, it didn't happen in 1986, but it did happen in 1987, as published in the Federal Register. August 12, 1987, the final rules and regulations for the acceptance and classification of 110 dental devices as being safe and effective, including Section 872.3050, amalgam alloy class 2, Section 872.3700, dental mercury class 1. They changed it to class 1. These experts have now ruled that mercury is not only effective as a dental device, mercury presents no risk whatsoever to human beings. That's what the dental panel reported. Right there. And it's in black and white in the Federal Register. I'm almost through now. All right, now, 15 March 1991, the FDA convened a dental products panel, part of the Medical Devices Advisory Committee, here in Washington, D.C. The dental establishment says this committee ruled that dental amalgam was harmless. That is a flat, out and out lie. I have the transcripts of that. I was there. I presented to that committee these violations of the dental device panel. It's on the record. Not only are these violations on the record with the FDA, but the conclusions of the panel is on the record. And I'm going to read to you directly from the transcripts of that meeting. Quoting the statement by Chairman Duncanson, quote, "Without the addition of any statements that reflect that the panel feels that there is any unsafety," isn't that beautiful, unsafety, "to the use of dental amalgam as a restorative material," notice dental amalgam, not mercury and alloy, "I would ask the panel now that the information under review today, if that information raises questions that warrant further research." I will poll the panel for a yes or no vote, and the vote was 9 yes, 0 no. Does that conclude that amalgam is harmless? No. It does not conclude anything about amalgam, safe or unsafe. What it says is we will not make any statements, but the information that was presented to us today is sufficient for us to say 9-0 that we must have for further research. Then they voted 9-0 to establish a committee to define the areas of research. Well, after this meeting, we then wrote to Dr. Lillian Yen, who was then the director of the Division of OB/GYN, ENT, and Dental Devices, under which the dental devices fell. And we questioned the FDA's position on dental amalgam, but they hadn't certified it. And it should be a Class 3 implant device requiring research. Dr. Lin wrote this letter on 2 April 1991. We have this letter. It states, quote, "I must remind you that FDA regulates manufacturers of medical devices. No manufacturer produces mixed dental amalgams. The mixed dental amalgam is prepared by dental clinicians. FDA does regulate manufacturers of dental mercury and amalgam alloys, but the only control FDA has over the ultimate mixed amalgam is through the labeling of dental mercury and amalgam alloys." That's it. Now, maybe the FDA has changed their position since 2 April 1991, a little over a year ago. But as of 2 April 1991, the FDA did not certify mixed dental amalgam. The FDA says that that's the dentist's responsibility, not theirs, just like the ADA said that. If the FDA has changed their position since 2 April 1991, we must see documentation. Opinions are not good enough. It's got to be in the Federal Register to be official. Otherwise, it's just somebody's opinion. So hopefully we'll find out something about that status later. Now, at this point then, here's the question. Since the FDA does not certify dental amalgam, can the removal of a dental device that is not legally sanctioned be a punishable offense? More importantly, can the implantation of dental amalgam, which is not certified by the ADA or the FDA, can the implantation of dental amalgam into humans without legal sanction be defensible without written permission from the FDA for its use as an experimental device? We got some legal problems now in dentistry because of all these mechanizations. OSHA has declared mixed dental amalgam to be a toxic hazard and must be disposed of according to its MSDS. That was printed in the ADA News. US EPA considered as a toxic hazard. That was printed in the ADA News. What we have today, then, mixed dental amalgam has been declared a toxic hazard by the ADA before being placed in human teeth, after being removed from human teeth, in the office by OSHA, in the environment by the US EPA, and nobody guarantees it once it's placed in human teeth, not the ADA, not the FDA. Which means then that in the United States, just as in Sweden, where the Supreme Court ruled that the responsibility for anything that happens with mixed dental amalgam belongs to the dentist, not the government, not the dental association. And this was published, guess where? ADA News. Okay, I think let's stop at that point before we get into NIH. Sure.
Yeah, we'll take a few questions if you like.
Can somebody turn the...
On that last thing about the MSDS, do we as Mercury-Free dentists, when we remove amalgam, although we're not placing it, do we still have to have MSDS sheets on amalgam for OSHA?
I would think so. We have it in our office in our traps. If we have it in our office in our traps, I think we have to have the... I know we have it in our office. We have MSDS on amalgam in our office. And because it's in our traps of our waste systems, it's in the office, and I think it's best to play it safe and have the MSDS. And of course, you know to handle it that way. You don't have to be told. Yes?
If we read high levels of mercury in our patient's mouth, do we have to report them to OSHA as possibly being beyond the limits of what's available in our environment?
I think OSHA's stand on that would be that OSHA is Occupational Safety and Health Administration. It has authority only over toxics in the workplace. I think Dave...
Employees.
I think Dave Kennedy will address that this afternoon.
Not you.
Much more thoroughly. And I don't think that OSHA considers a patient to be an employee in an occupational workplace. Yes?
Do you know any epidemiological studies underway how are Alzheimer's patients and now
Yes, I said that. All right. Do we know of any epidemiological studies underway that are attempting to investigate a correlation between Alzheimer's disease and amalgam fillings? The answer to that is yes. I thought I made that clear that the National Institute of Aging has awarded the University of Kentucky School of Medicine $780,000 to investigate a potential relationship between the occurrence of Alzheimer's disease and the amount of amalgam fillings in the victims. And that was last September 1991. It's a 5-year study. Lunchtime. Thanks.
Let's take a break for lunch. Why don't we extend, say, 15 minutes on the back end so that the speakers after lunch won't get heartburn and rush through. Let's meet back here at, instead of 1:30, make it 1:45. Okay? Thanks.
Is the room going to be talking?
I don't know.